It's a problem that affects many men the world over, and sometimes even women too. Hair loss. It can happen gradually or in some cases overnight. Well, joining us in the studio is Dr. Kevin Alexandra, the MD for Dr. Alexandra's Hair Loss Clinic. Well, he specializes in the treatment of typical balding as well as hair loss due to other causes. And a very good morning to you, Dr. Alexandra. Let's maybe just get the facts and the myth out of the way first, just in terms of hairlines and receding and crowns just starting to look a little bare as well. You know, what are some of the common reasons for this?
Well, certainly the most common cause of hair thinning in men and women is the inherited condition of what we call alopecia androgenetica, male or female pattern hair thinning. Probably 95% of all the patients that I see at my clinic in Bedford View come to me with this problem. And there are less common causes like alopecia areata, thyroid gland problems, iron deficiency anemia, vitamin A toxicity, and of course a host of even less common conditions.
But can this be reversed?
It certainly can. There's actually been a revolution in the last few years with regard to successful medical treatments that can actually regrow hair in both men and women. And I think the general public have very little knowledge of the fact that the latest medical treatments can deliver excellent regrowth results in a high percentage of both men and women. In fact, at our medical hair loss clinic in Bedford View, we are using these latest medical treatments to try and recreate the environment that existed around patients' hair follicles at the time that the patients were about 10 years of age. In other words, before they went through puberty, before the whole genetic and hormonal influence came into play. And if viewers are interested in having a look at some of the results of that, they can go to our website at hairloss.co.za.
Is there a difference between men and women in terms of how much they lose their hair, or even the causes as well?
Well, the cause is pretty much the same, but because we as men have got 400 times the amount of testosterone, the condition is far more severe in men. But post-menopausally, women do accelerate their hair loss.
Now, you talk about, reversing the situation, and there's, a lot of new medication and, medical treatments. Let's talk about some of these and whether or not, because there are a lot of people who advertise that we can get your hair back to what it was. And, are some people being conned into these situations?
I think so. I think people have to do their homework. They have to avoid being led astray by their emotions and by overhyped marketing campaigns. They need to look for absolute proof of safety and efficacy, and the only way you're going to find that is in clinical drug trials. And there are prescribed, prescription-only, clinically proven medicines which are highly successful in terms of growing hair back in both men and women. They do exist. And these have all been through all the drug trials. They have a sound scientific basis for working, and in fact they are very efficacious and certainly safe to use.
Can diet be a reason why you lose your hair?
You need to be extremely deficient in iron. You need to be toxic with vitamin A. In other words, diet can play a role, but not to quite the extent that most people believe.
Okay. What about pregnant women, or maybe even hormonal problems causing hair loss? What can pregnant women expect? Because there are some changes, of course, that happen to women.
In fact, during pregnancy, the high estrogen levels tends to improve the hair will thicken. But post-pregnancy, the estrogen level dives, and about 4 to 6 months post-pregnancy, you can expect a lot of hair shedding and a lot of thinning. This situation normally only lasts about 1 or 2 months. If it proceeds further than that, then there's normally an underlying genetic problem such as alopecia androgenetica present.
What can we just do at home to stimulate, the growth of the hair?
Very little. In fact,
we have to come to you.
All the old wives' tales, the massaging and the Bob Martin tablets, that kind of thing, it's not going to help, really.
Really?
Yeah.
Now, what about the fact that, there's a lot of, replacements. People are, using hair, and patches and all sorts of techniques that are people using, and the fact that how long can these last before, in your old age, obviously, you've got to lose some hair and have to accept it.
Well, in fact, that used to be the case. We now have medical treatments that can literally stop the aging of hair and keep your hair in a...
Let's just look at some of the pictures on our monitor here.
This is a lady with female pattern baldness. The photographs are taken 7 months apart. That's, what we call alopecia androgenetica.
What is that in simple language?
Well, it's basically the same condition that causes men to go bald occurring in females.
Okay. What about stress? Can lead to this situation?
Stress is an accelerating factor. It's not the cause of the problem, but it generally speeds up the problem.
Okay. But obviously medication alone cannot reverse the situation.
It absolutely can. In fact, if you look at this next photograph, these photographs are taken 7 months apart. Also a female patient with alopecia androgenetica, common female pattern baldness.
Okay.
And this is a photograph of a male patient, photographs taken 11 months apart.
Okay.
And this is 9 months from the first photograph to the last photograph with a patient with normal male pattern baldness.
Okay, very, very interesting. We have to leave it there, though. We have run out of time. So if anyone wants to find out any more information about how they can get their hair back on?
They can go to our website, www.hairloss.co.za.
Okay.
Or they can phone us 450-4400-011 code.
Okay, we'll leave it there for now. Dr. Alexandra, thank you very much for joining us.
Thanks.
That's Dr. Kevin Alexandra for taking some time to join us this morning and helping us make sure that we have our full head on. We'll be back after this break.